OECD Korea Policy Center, building a global network and promoting mutual learning between OECD and non-OECD countries. OECD Korea Policy Center. With a Memorandum of Understanding between the Korean government and the OECD, 4 centers including the Korea OECD Multilateral Tax Center, the OECD Korea Regional Center for Competition, the OECD Asian Center for Public Governance, and the OECD Korea Regional Center for Health and Social Policy have been established and operated respectively since 1997. With the conclusion of a new MOU between the Korean government and the OECD, 4 centers were integrated into the OECD Korea Policy Center in 2008. Since then, the OECD Korea Policy Center has been disseminating various advanced policy systems and experiences to government officials and experts in the Asia-Pacific region. The center also has been researching OECD's policy trends, hosting various expert meetings as well as international conferences. Building an international network for mutual cooperation between OECD member and non-member nations. The center consists of the Executive Secretary, the Steering Committee, Health and Social Policy Program, Tax Program, Public Governance Program, Competition Program, and Operation Planning Office. Among the 4 programs, the Health and Social Policy Program is responsible for the work related to health, social, and pension policies. The tasks include carrying out expert meetings and training courses for each area of health and social policies, publishing country papers, translating and distributing the publications of the OECD, conducting research projects, and strengthening policy networks in health, social, and pension fields. The details for each task are as follows. With regards to the international meetings with experts and government officials from the Asia-Pacific region, the Health and Social Policy Program provides opportunities for disseminating OECD policies and indexes and sharing policy experiences between countries. More in detail, the program has been hosting annual expert meetings respectively on health accounts, healthcare quality, access to medicine, social expenditure, pension policy, and a seminar on family policy. The program also provides training opportunities where commendable policies and systems are introduced to experts and government officials from non-OECD member economies in the Asia-Pacific region. Some examples of those are international training courses in social health insurance, social service fields and efforts to share Korean policy experiences, and from 2014, a training course on public pension in Asia and the Pacific has been operated. The Health and Social Policy Program has been supporting experts specialized in health and social expenditures in drafting reports for improving statistics and policy development capabilities of non-OECD countries in the Asia-Pacific region. Through these efforts, 18 green papers related to health expenditure and 5 blue papers on social expenditures were published. Furthermore, the program translates and distributes the OECD's periodical publications, including Health at a Glance, Society at a Glance, and Pensions at a Glance on a regular basis, and other OECD publications on the latest trends of health quality, health policy, inequality, family policy, and etc. Also, various in-depth studies to support health and social policies of Asia-Pacific countries have been conducted. In the health policy field, comparative studies, including international comparison of system of health accounts, have been conducted. Regarding the social policy, the program carried out researches on comparative studies on adult social care services and family policy in East Asia, respectively. In the pension policy field, Research on continuity and discontinuity of basic pension and public pension schemes in Asia and Pacific countries have been conducted. In addition, the Health and Social Policy Program have been strengthening a policy network on a domestic and international level by supporting related socio-academic organizations in Korea and government-sponsored international seminars, as well as participating in international conferences. In 2015, the Health and Social Policy Program will play its role by hosting international meetings in each field, including the 3 health meetings in June, September, and November, 1 social expert meeting, and a seminar on family policy in October, a pension expert meeting with an international conference in November. For the international training courses, we will carry out a program on public pension in Asia and the Pacific to disseminate pension experiences and systems in Korea in September, while conducting an in-depth study on pharmaceutical policy. As to the publication, a translated version of OECD publications like Making Mental Health Count and Country Technical Reports of Malaysia and a decade of social policy development in selected countries will come out. The Health and Social Policy Program will make the utmost effort to support development of the region by disseminating advanced policy trends and good practices and forming a human resource network within the Asia-Pacific region. Connecting people with people, culture to culture, and countries with countries. The Health and Social Policy Program at the OECD Korea Policy Center will be with you all the time. Thank you.